Hi, I'm Dr. Madeline Bellin, Veterinary Ambassador with Orvis, and today I'm going to show you guys in this video how to build a first aid kit for the outdoors, whether that's for hunting, hiking, fishing, or whatever your favorite outdoor activity is. In this box, my husband and I have built a larger first aid kit that then has some smaller bags in it that we use for specific things like packing in our hunting bag or bandaging, and then a medication bag. So I'm going to show you what's in here and how to use it. A lot of injuries and illnesses are actually preventable and treatable in the field, but first aid should never be substituted for proper veterinary care, but rather used in the interim to get you to a veterinary hospital while you're on your way there with your dog. So we have this larger Yeti loadout box that we have chosen. It works really nice, holds quite a bit. We then bought a first aid kit from Orvis, and it actually contained a lot of the things that we need in there, but then we took what's in there, separated it out into categories. So I'm going to show you that. So this first bag, this is our medication bag, which I'll review here in a little bit. This smaller bag is the one that we can just quickly grab out of this box that stays in the truck and put it in the hunting bag and take with us for the day. And it has things that we need maybe immediately before we can get back to the truck. Then we have our dedicated bandaging bag. There are a lot of things that you need to put a bandage on, and so it's nice to have it all in one area. So we're gonna go over how to bandage here in a minute. So in this bag that has all of our daytime emergency stuff that we're gonna bring with us when hiking, hunting, or fishing. Let me get all of this out here. All right, so some of the things in here are specific. So we're going to go over superficial wounds and abrasions, deeper lacerations that have active bleeding, puncture wounds, different foot injuries, eye injuries, and then insect bites and stings. We have saline and gauze along with a syringe. These are going to be some important things for your superficial wounds and abrasions. Those are going to be wounds that don't puncture the skin, they're just on the surface, but still need treatment. And so best thing to do is go ahead and rinse the wound with saline and then blot it dry with gauze. So we've just carried a stack in here that you can apply pressure to a bleeding wound and then also dry it with. There's a syringe as well if you need to use that to apply the saline, and then a little bit of triple antibiotic ointment that you can put over the wound when you're finished cleaning it and drying it. The next wound you might encounter would be lacerations and bleeding. Lacerations are going to be deeper wounds that actually go through the skin and are actively bleeding. You can use gauze again to apply firm pressure. First thing you want to do is stop the bleeding, so that pressure should be applied for 10 minutes. If it's still bleeding after applying pressure, there might be an artery involved, and in that case, you do need to get to a veterinarian as soon as possible, but you can apply a tourniquet in the meantime. A good makeshift tourniquet is going to be a buff, whether that's in your first aid kit or maybe you're wearing one, but they work really well while you're getting to the vet. So tourniquets, and we will put links to everything that's in the first aid kit so you can build your own. But puncture wounds are the next thing. So puncture wounds, these again go deeper into the skin. They often extend much further than you can see from the surface and likely will have bleeding. So again, control the bleeding. And if you can't control bleeding with the gauze that you have, there is a tampon in there that you can insert into the puncture wound while you're getting to a veterinarian. Foot injuries are the next thing. They're also very common in the field, whether that's to the paw pad or the webbing in between the toes. These can be lacerations again, so a cut to the webbing or the paw pad, or maybe a grass seed that has gotten stuck in there. So again, control the bleeding. Go ahead and clean the wound with your saline, blot it dry. If you see a grass seed or something like a twig or something that's sticking out of there, there are tweezers in here as well that you can use to try to remove it. And often with foot injuries, you're going to need to apply a bandage, so we will be going over bandaging here soon. torn toenails are another injury that you might encounter. It's important to keep your dog's toenails trimmed before you even go out to try to prevent this injury. Long toenails can become stuck in between rocks or caught on different objects and tear, and when they do, it's pretty painful. The torn toenail is going to expose the quick, which is the sensitive part of the toenail that's under the actual nail, and it's often going to be what's bleeding. If you have a broken toenail, use your toenail trimmers to clip the toenail that's broken and probably hanging there so that it doesn't keep getting caught on stuff. And then use a quick stop powder or some cornstarch to apply to the quick to stop the bleeding. Once you have the bleeding under control and your dog's a little bit more comfortable, clean the quick with saline and then blot it dry with gauze again. And then we'll talk about applying a bandage to that foot before you can get back to a veterinarian. So insect bites and stings are another common injury you might encounter. Usually they're going to be localized inflammation and swelling wherever the bite or sting occurred, but they have the potential to cause a more systemic effect and can cause difficulty breathing, hives, swelling, vomiting, and diarrhea. If you notice any of these things, make sure to call your veterinarian right away as your dog's experiencing a bigger allergic reaction. If it's just localized though, and you can see a stinger in there, you can use tweezers to remove it and then apply an instant cold pack to the area for 20 minutes to help with some of the swelling. The other thing to do is give your dog Benadryl. So carrying the 25 milligram tablet size of Benadryl in your first aid kit is really important. The dose is 1 milligram per pound. And what I've done is write this on the back of ours, so if I'm not there, my husband knows what the dose is in the field, and go ahead and start that for your dog to help with the reaction that they're having. Next, we will go over fish hooks. If they are in the skin and it's not too deep and you can see where maybe a little bit of the tip of the hook is, go ahead and push the hook through the skin until you can grasp the tip of the hook where the barb is at, and use needle nose pliers to cut the end of the barbed hook off, and then you can back the rest of the hook out of the original entry point. If the fish hook is a lot deeper, that's going to be something that requires sedation and you won't be able to do in the field, but go to your veterinarian and they can remove it for you. If your dog swallows a hook, there's a risk of this causing injury to their esophagus or their stomach or in their intestines, and you do want to call your veterinarian right away if that occurs. All right, the last few things we have in here, we have a thermometer. On here, I've written the normal temperature for a dog, which is 99.5 to 102.5. Use this to take your dog's rectal temperature. The other couple things, we have hemostats. Also, you can use needle nose pliers, but we have these in here in case our dogs encounter porcupine quills, which we'll do another video explaining how to remove porcupine quills, but that's why those are in here. And then lastly, an emergency space blanket for warmth if you're out in some cold weather. So that's it for the pack that we have that we carry on a daily basis. I'm gonna pack this up. In our next bag, this is our medication bag. In here we have different medications for pain, diarrhea, and anxiety. So I'd recommend setting up an appointment with your veterinarian prior to your hunting season, or maybe if you do a lot of hiking, prior to going out for these things, and see what's best to carry for your dog. It's really going to vary depending on your pet's needs. So set up an appointment before you go out and see what you can carry. So I'm gonna go through what's in our bandaging kit, and then we'll demonstrate how to put a bandage on my dog Bodhi. First thing we have are gloves. You wanna wear these, make sure to keep yourself protected from any bleeding. If your dog's wound is bleeding, stop the bleeding first with gauze by holding pressure for at least 10 minutes, and then clean the wound with saline, and then blot it dry with gauze so that the area is dry, it's not bleeding, it's clean before you ever put a bandage on. We have sterile, non-adherent pads. These will go over whatever wound or laceration you're trying to cover. Next, you'll cover that with cast padding, followed by white gauze, and then vet wrap over the top. We have a couple different kinds of tape in here, different sizes depending on what wound you're bandaging and what you're trying to cover. Last thing for the bandage is going to be some elasticon to help keep it up. And then scissors are in here as well to cut any bandaging material. The last thing is a plastic bag that you want to put over your dog's bandage. You don't want the bandage to become wet or soiled. And so this can be put over their bandage and then tied to help keep it dry. All right, let's head out and put a bandage on Bodhi. So we're gonna go ahead and put a bandage on Bodhi's right front foot here. We'll pretend that his wound is right here on this lower aspect of his foot. So assuming that we've stopped the bleeding, the wound is nice and clean and dry, we can now put our bandage on. So we'll start with the non-adherent pad that came in this little packet right here. We'll put this over our pretend wound right here. And next we'll use our cast padding. So we just want to gently, but tight enough that this is going to stay on, but you don't want to be cranking this around. One of the most common mistakes that people do when they put a bandage on is they put it on too tight, and so then it ends up causing swelling of the foot. So just gently roll this around tight enough that it's going to stay up, but not so tight that we're going to cause swelling. We are going to include his little joint right here above the wound. It's going to help his bandage stay up. So we're going to go above what is like his little wrist, go down, include his toes here. And this cast padding, do put a generous amount on, kind of like the name implies. It is padding for the bandage and helps protect whatever wound is sore for them when they might be walking or if they bump into other things. So that's our first step. Next, we're going to cover this cast padding with the gauze. So same thing, just follow where you've already put the cast padding on. Stay. All right, next we are going to put vet wrap on. This is probably the most common place that people come into trouble with putting it too tight. So vet wrap is pretty stretchy and then it adheres to itself. And so if you're cranking around on that, it's very easy to get it on too tight. The best thing to do is unroll some of it before you begin and then just gently roll it back up so you're not having to pull really hard to unroll it. And then start applying this over his bandage. You want to cover about 50% of the first layer that you put on. So this is the first layer. I'm going to cover about 50% of that with the next layer I go around. And when I run out of the part that I've already kind of pulled out here, just go ahead and pull some more out. Gently roll it back up. And with your vet wrap, you always want to leave a little bit of space from your previous bandages at the top here. So don't have the vet wrap come over the top like this. So the last thing you see is skin and then the vet wrap. You want to see some of your cast padding and gauze sticking out at the top. All right, lastly, we're going to get a little bit of elasticon. This is really stretchy and sticky here, and it works well on the bottom of bandages. So when your dog is walking on it, they don't wear through the material. So we're going to put a nice little bit of it on the bottom here. And then I'm going to grab one more piece for the top. I'll put that around the top of his bandage. And then that's it for the bandage itself. We also have this bag in here if Bodhi were in an area where maybe it's raining or the bandage might get wet on the bottom or soiled in some sort of way. You do want to protect the bandage by putting a little plastic boot over it. So we'll put that over it and then use some gauze at the top to tie it so it stays up. And that's it for your bandage. Remember, this is just to get you through until you can get your dog to a veterinarian, but always, apply your first aid knowledge in the field and then take your dog in to see your vet.